We're here at St. Pete Urology discussing men's health today, here with Dr. Larangakis. My name is Dr. Reed Graves. We're going to touch on a few topics that hopefully will be interesting to our viewers. We also touched on the idea of cancer being related to men's health. With respect to prostate cancer, a lot of primary care doctors, which is the first line in healthcare for most patients, have stopped checking PSAs, which stands for prostate-specific antigen. And we've seen some of this in the news and the newspapers. Can you just tell us a little bit about the PSA test and how the new guidelines have come out with defining age ranges and discussions with patients, and how that applies to patients who maybe have primary care doctors that have stopped checking their PSAs?
Sure, this is also another area that's come to light recently about screening for prostate cancer, whether you should and shouldn't. And this screening test involves a rectal exam to see if the prostate feels smooth and make sure there's no nodules, and also the PSA test Dr. Graves mentioned. That's just a normal blood test you would get with your routine blood work. And it's a very important area to cover because it is a very common cancer, and screening is important to find cancers early. That's why we screen, usually trying to find the cancer before it causes any symptoms. So with prostate cancer screening, it's important to get that checked, and if unfortunately the PSA level is high, it is used to determine whether we should or shouldn't do a biopsy for diagnosis. Prostate-specific antigen is not a perfect test, but usually if we trend it and make sure we have the appropriate levels, it'll determine whether or not we should do a biopsy for diagnosis.